For my community healthcare project, I will be focusing on the community of Darlington, Wisconsin, located in the southwestern corner of the state. My name is Cassie Hull, and we will be talking about Darlington. Darlington is a small community of 2,464 people. The population consists mainly of Caucasian and Hispanic residents. The main employers found within Darlington are related to either agricultural production or industry. Within the small town, we have one rural critical access hospital that serves to offer limited primary care in addition to emergency care as well. Darlington is made up of mainly lower class and lower middle class residents when looking at a majority. As stated previously, farms and agricultural production jobs make up the majority of employers in Darlington. Despite the neat-looking Main Street and downtown, Darlington does struggle as a community with the upkeep of its neighborhoods, roads, and sidewalks, limiting the ability of disabled persons to move around freely. When examining areas of concern, infection control becomes a problem in the winter months and during the school year. Young children and the elderly are particularly susceptible to infections, including influenza and COVID-19. In addition to infection control, the community is rather isolated geographically. Without access to a vehicle, it becomes difficult for residents to get around. Despite the different struggles faced, Darlington has produced a tight-knit community that comes together to include all cultures and residents in its festivities throughout the year. When looking at the statistics related to Darlington, Wisconsin and its population, we can see that there's a relatively small amount of area that encompasses Darlington. The average age of a Darlington resident is 40 years old, with older adults consisting of roughly a third of the adult population. Males outnumber females slightly within the area. The average income is around $58,000 a year. Average rent is around $800 a month, and the average house cost is just over $100,000. The employment rate is 62.2%, with unemployment rate at 1.2%. Over 90% of residents have health insurance. The poverty rate is slightly over 8%. And when looking at health-related statistics, 10.4% incidence of diabetes is occurring in Darlington, and there are 46.2% rate of alcohol-related motor vehicle deaths. And then when looking at cases of COVID-19 diagnosed in Swann County, we're roughly at 3,500. As we can see above, the employment rates are excellent. However, the poverty rate is quite high and is highest among Hispanic and Black populations. In addition to poverty rates, the percentage of alcohol-related motor vehicle crashes is significantly high, lending evidence to a problem with alcohol in the area. Lastly, for a small county, the number of COVID-19 cases is quite high, particularly considering that many residents work and seek medical care outside of the county and area. When looking at community partners and resources for the area, partners include the Dane County Health Department and the Wisconsin Department of Children and Family Services. When looking at resources, these include the Child Care Information Center and the Wisconsin Early Childhood Collaborating Partners. Each of these community partners and resources provides assistance to those in southern Wisconsin. The community partners provide information on communicable diseases, information about seasonal illness outbreaks, and ways to mitigate infections. The community resources provide a central source for information regarding the care of children, infection control in children, and information on other organizations and their roles related to child care and infection prevention. After examining all of the information related to Darlington and its statistics, The community nursing diagnosis that I have developed was the risk for infection among pre-kindergarten children in southern Wisconsin related to the transition into the public school district, related to deficient knowledge due to age, related to limited resources for infection risk education, related to improper hygiene practices, related to developmental level as evidenced by increased COVID-19 cases and increased influenza cases among children during the cooler months. With increased COVID-19 numbers in the upcoming influenza season, children are at an increased risk for infection. In addition, the children in the pre-kindergarten class at Pooh Bear Child Care will be entering the school system this fall. Within the school system, the children will be largely responsible for their own hand hygiene and thus would benefit the greatest from a presentation and demonstration on proper hand hygiene. The community health plan for Pooh Bear Child Care and the nursing diagnosis of risk for infection includes designing a presentation to teach preschool-age children the importance of hand hygiene, how to wash their hands, and when to wash their hands. The presentation will focus on fun, informative activities to retain their kids' attention while educating on hand washing. And the community health plan will provide a demonstration related to the importance of hand washing to allow children to visualize the germs themselves. This community health plan on infection control focuses on the implementation of multiple educational techniques, including visual presentation, hands-on learning experience, and teach-back moments to evaluate the efficacy of the education. There are numerous interventions being utilized when educating the children about hand hygiene. Creating a poster board will allow the children to visualize the hand washing steps. Verbal instruction on hand hygiene steps to the children will allow them to learn the steps and to practice along. Explaining what germs are and what they do will educate the children on the importance of why hand washing is necessary. Demonstration of the process of spreading germs from a dirty hand to a clean hand through glitter, lotion, and paper will allow the children to participate in the presentation itself, in addition to being able to visualize the process in order to better understand how germs are spreading and why it's so important to keep your hands clean. And lastly, providing a pamphlet to the children's parents will allow the hand hygiene practice learned at Pooh Bear to travel home with them. These interventions are focused on educating the children while engaging their attention through hands-on learning activities. Specific identifiers were used to retain information, including washing hands for 20 seconds by singing the Happy Birthday song twice, and remembering to use warm water for washing. In order to evaluate the children's learning in terms of hand hygiene, the children were given pictures with miniature printouts of the hand washing steps cut out. At the end of the presentation, the children were instructed to glue the correct step with the correct numbers 1 through 5, on the sheet of paper. Following the completion of this activity, the children were able to bring these sheets home in order to promote hand hygiene at home and have easy access to those hand washing steps. The children were able to correctly print out or follow along with the hand washing steps and glue them in the correct spots at the end, indicating that they had retained the knowledge first taught at the beginning of the presentation. At the end of the presentation, teach-back was also used to discuss the proper length of hand washing time, as well as when to wash your hands and why we wash our hands. In conclusion, Darlington is a small, tight-knit community in southern Wisconsin with many positive attributes as well as areas for improvement. With the upcoming cold and flu season approaching and a school year as well, risk for infection proved to be the greatest concern, particularly among younger children. Hand hygiene continues to be one of the best ways to prevent infection in children, and through this community project, the children of Pooh Bear were able to demonstrate proper hand hygiene following the presentation and educational sessions given to them. Overall, I would state that this project was successful in its ability to teach not only the children but to provide resources for the parents to encourage a culture of hand hygiene both at school and at home within the community.